Good morning and welcome to Ask Dr. Murphy this week in public health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy all the way over the ocean today. How are you this morning or
Doing
afternoon?
doing very well. A little cooler over here than in Chicago.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He'll be addressing the latest headlines through today, February 19th, and any questions or comments are welcome down below or at any of our social media linked in the description. Starting today with pediatric COVID cases, some strong research out of Poland shows that these hospitalizations could be getting less severe. Can you tell us the data?
Yeah, this is a retrospective study from Poland where they had data from five Polish pediatric centers in the 23-24 year and 24-25 seasons for a combined total of 366 hospitalizations. And what they found was the difference between the years that blood oxygen saturation, the need for oxygen supplementation, and the likelihood a patient was actually admitted in an unstable condition um, became less over time. Um, and this is just some nice evidence that shows what we were thinking all the time, that Omicron was less severe. Remember, Delta was the bad one. And not only is it less severe, it's even getting less severe over time. So the Omicron is they're constantly mutating. And this, as long as we're in that Omicron family, it seems to be a very weak virus.
Oh,
That's good.
yes, very, very good. And another great study that we got this week was adding to the mountain of evidence for the safety of the mRNA COVID vaccines, this time specifically for pregnant mothers and their child in utero. Can you break down the study?
Yeah, well, there's always concern giving a pregnant woman any kind of vaccine, any kind of treatment. But this was looked at very early on, and it was clear that giving the COVID vaccine to pregnant women caused was associated with fewer complications of the pregnancy, and fewer problems with the babies, and even fewer deaths of babies. It just was really it's already been shown. So this is just more data on top of everything else. And this analysis that was reported by Dr. Brenna Hughes of Duke University showed in 434 children aged 18 to 30 months, and 50% of the mothers received at least one dose of the COVID vaccine. And what they were looking at here weren't really, they were looking at, how much COVID there is and stuff like that. But they drilled down specifically in problems with babies at birth, the developmental problems. And they looked very hard at development of communication, gross motor skills, fine motor skills, problem solving, and personal social interaction. And there was absolutely no effect, no
Yeah.
adverse effect.
Really great study there. Like you said, we
Yeah.
usually talk about the clinical side and how much COVID there is, but
Hmm.
important that they're looking at that development side too.
Yeah, of course. And these are the kind of reports we would expect to be seeing now as we get over the huge part of the pandemic, and we can drill down and look and see, if these things are causing other problems. And so far,
And
so good.
exactly to that effect of COVID potentially starting other problems, something perhaps little known is that COVID may have an effect on male fertility. Can you break down these findings?
Yeah, this is a study published in Vaccines, the name of the journal, very reputable, from a group at a university hospital in Sichuan, China. And they found impairment of male fertility 3 months after COVID infection. So it's not a long study. We don't know the overall, years outcomes, except what they found was really kind of disturbing. And they found that the quality of the sperm and the semen and the volume are all reduced after COVID at 3 months. Those are bad signs for fertility. Um, you would think, oh, is it affecting testosterone, the male hormone? And it had no effect on testosterone. They did notice that there were higher estradiol and prolactin. Those are hormones that men have, but they're much higher in women. They found a slight increase in those hormones in these men. But it looks like there's a direct effect of the virus on the semen production, and that would probably translate into a fertility problem if that persists. We don't know. Now it has to be looked at, really long term. But just another reason why you don't want to get COVID.
Just another reason, and we will keep an eye out for those long-term studies as they come out. But
Mhm.
switching gears today, we're switching to Cambodia. We talked about China last week, but there is another human avian flu case, this time H5N1. Can you bring us the
Uh-huh.
details?
Yeah, they reported their first avian flu case of 2026. It was a young man who has fully recovered. Since 2023, Cambodia has reported 36 human cases of avian flu, with a historical case fatality rate of 40%. So it's not going away, basically, is what the message is here.
Mhm. And what else is not going away? The measles outbreak here in the United States. We won't get an update from the CDC on case numbers until tomorrow, but I understand we do have some statewide updates you can share with us.
Yeah. So the measles outbreak is still going strong in South Carolina. They had 12 more cases. But what's important here is that they're now finding it in southwestern Florida at a small Catholic college, the Ave Maria University, which did have a mandate for measles vaccine of the students. However, students could opt out. So I guess it's really not a mandate because many students have opted out. Most of the students are vaccinated, but measles is so contagious that if you drop below 93 to 95%, it's going to spread in that population. And, here they've got 60 cases in this small area. So, in college campuses, the students are all very close together in the classrooms and then intermingling. So there's a lot of things that can get transmitted that normally don't get transmitted in other settings. So this was another wake-up call for measles, and you can have problems with measles no matter how old you are.
Mhm. It's like you said, as long as you are unvaccinated and you come into contact with someone who's infected, there's a very, very high likelihood that you could end up infected as well.
Very high.
Now, our final story today is something a little bit different. Out of Minnesota, it seems that there is a new sexually transmitted disease that may have some sort of fungal element. Can you please break it down for us?
Yeah, it's new to the US. It's been reported in Europe, but there's an outbreak of 27 cases in the Twin Cities area. And it looks like it's being transmitted sexually and it looks like ringworm. So if you had kids that had ringworm, it's this circular thing with a clear center. Anyway, it's caused by this fungus TM7. And people who are sexually active who come in with a ringworm type rash, especially if it's in the genital area, and and they're having different sexual partners, they should think that maybe this is this TM7. Why is that important? Well, there is treatment for this, but it's not just some over-the-counter cream. You have to actually take an antifungal pill um, for maybe a couple months. A little bit unclear exactly how they're treating it, but I think this will shake out pretty soon. But yeah, people should, doctors and clinics and people who are having multiple sexual partners or a new partner and they get a ringworm type rash, they need to think about that.
Something very important to be aware of. And on that note, I'd like to thank you, Dr. Murphy, for bringing all of these stories to our attention, breaking down the most important details, and helping us understand why they're so important.
Well, thank you, Katie.
And thank you all for joining us for this week's episode of Ask Dr. Murphy, This Week in Public Health. We hope to see you again next week. As always, any questions or comments are welcome down below. And have a great weekend.
Great, you too.
Thank you so much. See you next week.